Welcome back. I'm an emergency doctor actively working at the emergency department of my hospital. In this Doctor's Corner series, we'll dive into lesser-known approaches and hidden strategies to help the people with critical illnesses. You can subscribe if you want to learn the latest news and healthy solutions about your life. Today, let's talk about indecision and why making a plan can be one of the most practical ways to move your brain from stuck to steady. Indecision can look simple from the outside. Someone says, just choose. But inside the mind, it may feel like every option has a hidden cost. What if I choose wrong? What if I disappoint someone? What if I miss a better option? What if I regret it tomorrow? Ask yourself this. When you are unable to decide, are you really lacking intelligence, or are you trying to protect yourself from uncertainty? In the emergency department, decisions happen under pressure. We gather information, check danger signs, consider likely causes, and act. We do not wait until every possible question in the universe is answered, because life does not work that way. But we also do not act randomly. We use plans. We use protocols. We use priorities. Why? Because a plan reduces mental noise. It tells the brain, here is the next safe step. Look at indecision as a load on the nervous system. Your brain is trying to predict the future. It compares options, imagines outcomes, remembers past mistakes, and scans for threat. When anxiety is involved, that threat scanner becomes louder. Many people with generalized anxiety describe fear of making the wrong decision. That does not mean every indecisive person has an anxiety disorder, but it shows us something important. Decision-making is not only logical, it is emotional, physical, and behavioral. Pay attention to your body when you cannot decide. Is your jaw tight? Is your chest heavy? Are you refreshing reviews again and again? Are you asking 5 people for reassurance, then feeling even less certain? Are you delaying a phone call, a health appointment, a work task, or a relationship conversation? Indecision often feeds on avoidance. Avoidance gives short-term relief, but it usually increases long-term stress. So how does making a plan help? Start with this idea. A good plan changes a vague decision into a sequence of smaller actions. The brain handles, what is my entire future? Poorly. It handles, what is the next step before 3 p.m? Much better. A plan narrows the field. It creates boundaries. It defines what information is enough. It sets a time to act. It also protects you from making the same decision again and again. Think of a simple example. You need to decide whether to see a doctor about a symptom. Without a plan, you may search online at midnight, become frightened, calm down, then repeat the cycle. With a plan, you say, if this symptom is severe, sudden, or associated with chest pain, shortness of breath, weakness on one side, fainting, severe bleeding, confusion, or suicidal thoughts, I will seek urgent help. If it is mild but still present after 48 hours, I will call my clinic. If it improves and no danger signs appear, I will monitor it and write down changes. That plan does not diagnose you. It does something else. It gives your brain a safer pathway. Do this with everyday decisions too. Write down the decision in 1 sentence, not 10 sentences. 1. I need to choose whether to accept this invitation. I need to decide when to begin exercising again. I need to choose which task to do first. Why 1 sentence? Because indecision grows when the mind keeps changing the question. Define the question before you try to answer it. Then set a decision level. Ask yourself, is this a reversible decision or a hard-to-reverse decision? Choosing dinner, choosing an outfit, choosing the order of errands, those are low risk and reversible. Do not give them the same mental energy as a medical procedure, a financial contract, or a major move. Make a rule. Low-risk decisions get a short time limit. 5 minutes, 10 minutes. Decide, act, and move on. For higher stakes decisions, make the plan more structured. Start with values. Ask, what matters most here? Safety? Health? Time with family? Financial stability? Learning? Peace? When values are clear, options become easier to compare. If your value is health, the plan may prioritize sleep, medication adherence, follow-up appointments, and avoiding choices that worsen symptoms. If your value is family stability, the plan may prioritize communication and predictable routines. Next, list your options, but limit them. 3 options are often enough. Option A, Option B, Option C. Too many choices can overload attention and increase avoidance. More information is not always better. Ask, what information would actually change my decision? If the answer is nothing, stop gathering. If the answer is one specific fact, go get that fact, then decide. Do not let research become a socially acceptable form of avoidance. Now use an if-then plan. This is one of the strongest planning tools in behavioral science. It links a cue to an action, not "I should be more decisive." That is too vague. Say, if it is 7 p.m, then I will choose tomorrow's top task. If I feel the urge to ask for reassurance a 3rd time, then I will pause, breathe, and check my written plan. If I have 2 reasonable options and no clear danger, then I will choose the option that matches my top value. How does this help? It reduces the number of fresh decisions your brain must make in the moment. The cue appears and the next action is already chosen. Make your plan visible. Put it on paper. Use your phone notes. Use a calendar reminder. Why write it down? Because the mind under stress is not a perfect storage system. In medicine, we write orders, document findings, use checklists, and communicate plans. We do this not because memory is useless, but because memory is vulnerable when pressure rises. Treat your personal decisions with the same respect. Look at the role of emotion. A plan is not meant to erase emotion. It helps you act while emotion is present. Many people wait until they feel certain, but certainty is not always available. Confidence often comes after action, not before it. Ask yourself, am I waiting for perfect certainty, or do I have enough information to take the next safe step? That question can break the loop. Use the 70% rule for many non-emergency decisions. If you have about 70% of the useful information and the downside is manageable, decide. Not every decision deserves a courtroom trial inside your head. Some decisions need movement, feedback, and adjustment. Make a plan, act, observe, revise. That is not failure. That is how healthy decision-making works. But be careful. Planning can become over-planning. If your plan has so many steps that you never begin, simplify it. If you spend 3 hours designing a morning routine but never sleep on time, simplify it. If you build a spreadsheet for a small choice and still feel trapped, pause. Ask, what is the next physical action? Send the message. Book the appointment. Put on the shoes. Open the document. Drink water. Turn off the screen. The body often helps the mind move. For people with chronic illness, planning becomes even more important. Fatigue, pain, medication schedules, glucose control, blood pressure monitoring, appointments, and side effects can make daily decisions harder. Do not rely on willpower alone. Use routines. Keep medications organized. Confirm interactions with a pharmacist or clinician before adding supplements or stopping prescriptions. If you are pregnant, trying to become pregnant, elderly, immunocompromised, or managing conditions like heart disease, kidney disease, diabetes, epilepsy, or severe depression, do not use a personal plan as a substitute for medical guidance. Use the plan to organize questions and seek care at the right time. Now let's build a practical decision plan together. First, name the decision. Say it out loud. I am deciding whether to. This prevents the decision from spreading into every part of your life. Second, define the deadline. When must this be decided? If there is no real deadline, create a reasonable one. Indecision loves open space. Third, identify danger signs. What would make this decision urgent or unsafe to delay? In health matters, take severe symptoms seriously. Chest pain, trouble breathing, stroke-like symptoms, fainting, severe allergic reaction, severe dehydration, heavy bleeding, thoughts of self-harm, or sudden severe pain need prompt evaluation. do not sit at home trying to plan your way through a possible emergency. Fourth, choose your criteria. Pick 3. For example, safety, cost, and time, or health, family, and long-term benefit. Keep it to 3. More than that can restart the loop. Fifth, decide what information is enough. Ask, what do I need to know before I choose? Then ask, where is a trustworthy source for that information? For medical choices, use your clinician, pharmacist, official health resources, and evidence-based guidance. Be cautious with random posts, fear-based videos, and miracle claims. Sixth, choose the next action, not the entire life path. The next action: call, schedule, decline, accept, prepare, rest, ask, begin. Seventh, review later. Put a review point on the calendar. This is powerful because it tells the brain, I am not trapped forever. I will reassess. Many decisions become less frightening when they are treated as adjustable. Pay attention to self-talk. If your inner voice says, I always choose wrong, challenge that. Look at the evidence. Always? Really? Or have you made many workable decisions and remembered the painful ones more strongly? The brain has a tendency to focus on threat and regret. A written plan helps balance that by showing the actual steps, not just the fear story. Ask yourself another important question. Whose approval am I trying to guarantee? Sometimes indecision is not about the options. It is about fear of judgment. A plan can include communication. Say, I've thought about this and I've decided to do this because you do not need to convince everyone. You need a decision that is safe, reasoned, and aligned with your values. For parents, caregivers, clinicians, leaders, and anyone responsible for others, planning also reduces emotional spillover. When you are exhausted, hungry, sleep-deprived, or overwhelmed, decision quality can drop. Do not make every important decision at the end of a draining day if it can safely wait. Eat, rest, step away, and come back with a plan. If it cannot wait, use a checklist or call someone qualified to help. And if indecision is persistent, severe, or interfering with work, relationships, hygiene, eating, sleep, medical care, or basic responsibilities, take that seriously. It may be connected to anxiety, depression, obsessive-compulsive symptoms, ADHD, trauma, substance use, or another health condition. Ask for professional evaluation. Therapy, especially structured approaches that work with thoughts and behaviors, can help many people. Medication may be appropriate for some, but that decision should be made with a qualified clinician who understands your history, other medications, pregnancy status, and medical conditions. Remember this. Making a plan is not about becoming a person who never feels doubt. Doubt is part of being human. A plan helps you stop treating doubt as a stop sign. It turns doubt into a signal to check your steps, protect your safety, and move with care. So today, choose one decision you have been delaying. Write it in one sentence. Set a deadline. Pick 3 criteria. Decide what information is enough. Create one if-then step. Then take the next action. Keep it small, but make it real. Indecision shrinks when action becomes structured. Your brain does not need endless reassurance. It needs a safe path, a clear next step, and permission to adjust as new information appears. Take care of yourself, be kind to your mind, and do not hesitate to seek help when symptoms feel heavy or unsafe. I'll see you in the next topic where we'll keep building healthier decisions together.